Southeast Radio's Business Matters with Karl Fitzpatrick.
Well, during the COVID-19 pandemic, serial entrepreneur Cormac McKenna developed an idea to improve patient interactions with pharmacies. PharmacyConnect has already facilitated over 200,000 patient interactions with pharmacies, and they're only getting started. Cormac joins us now to tell us more. Cormac, we'll be discussing the success of PharmacyConnect, but first, this is not the first business that you've been involved in, as you are also the CEO of Village Pay and co-founder of Sheology. So how have you developed such a diverse portfolio of businesses?
I guess, first of all, Karl, I co-founded Sheology with my wife, Sandra, over a decade ago now. And I guess that was my first introduction into digital media and digital products. And for those who don't know, Sheology is the business behind the leading female-focused websites in Ireland, Magic Mum, Mummy Pages, and Shamazing. And really just in recent years also followed on with that, just developing a business for restaurant payments called Village Pay. And actually, that was the business that we were working on as we went into COVID. And I suppose really just around the disruption around COVID and finding that we couldn't really, or it wouldn't really be fruitful to push on with trying to develop software services for restaurants was something that led us to PharmacyConnect.
I'd like to take you back to the COVID-19 pandemic because it acted as an inspiration for PharmacyConnect.
It did, absolutely. And as I mentioned, we were working on the Village Pay product. I think it was around the time of the second COVID lockdown. And really, if you remember back then, there was a lot of disruption to people's lives and to businesses. And of course, the health service was under a lot of pressure at that time. The pharmacies in particular were the ones who kept their doors open right through that period. And I was personally struck by really how under pressure the pharmacies were, but also in terms of the patient's ability to connect and interact with their pharmacies. There didn't really seem to be technology there to help them to do that. So really going from my own personal experience with my own local pharmacy, really seeing what was happening from day to day and thinking that there must be a better way for pharmacies to be served and for patients to be served.
So on that basis, how does PharmacyConnect actually work?
So what we do is we develop white labeled apps for pharmacies. So if your local pharmacy has a PharmacyConnect app, you won't actually probably really see the name PharmacyConnect. You'll see the name of the local pharmacy, and your local pharmacy will direct you into the App Store, the Apple App Store, the Google Play Store to get what they call their app, right? So what it actually does is as a patient, it allows you to manage your prescriptions and to be able to see what prescriptions you have from day to day, and also to be able to communicate really clearly with your pharmacy what it is that you want. And it doesn't actually sound like rocket science, and it isn't, and it shouldn't be. But I suppose the important thing is that it actually works, and that patients love to use it because it's a great user experience. And really importantly, on the other side of that is that it really has to work for the pharmacies, right? So it shouldn't be creating extra work for the pharmacies. In fact, our goal from day one was to make things easier for the pharmacy staff. And what our pharmacies tell us today is that having a PharmacyConnect app in place for their pharmacy saves them something like 30% or more of the time that it would otherwise take them to deal with their customers.
What are the benefits for the individual consumers then?
Really, this is about convenience. I mean, if you take a typical patient of a pharmacy, if they're trying to contact their pharmacy, if they're not actually on the premises, they're either calling or they're emailing generally, or in some cases they might be sending a message by social media. And if they're doing it through their app, then they're able to do this in a trusted environment which is contextually relevant for the business that they do with their pharmacy, but also importantly, it kind of shows them what they've done in the past or over time. So typically a patient may have been last in contact with their pharmacy maybe a month ago, and it allows them to take up that communication from that last point where they were last in contact, and be able to easily tell the pharmacy or select whatever items they want and be able to put that request into the pharmacy. So really it's about ease of being able to do that. And then following on from that, we also have the ability potentially to pay if the pharmacy wants to set that up, and to have to organise deliveries through the app as well.
So has it been difficult to get buy-in from the pharmacies to date?
You know, certainly around the earlier part of our journey, we were very careful about being able to develop a sensible product and something that we wanted to be able to show that worked both for the patients and for the pharmacies. And I should say as well that in years gone by, you know, we're not the first people to think that having a pharmacy app would potentially be a great idea. But some of those previous incarnations didn't really work in the way that maybe they should have. So certainly in the earlier days, you know, some pharmacists may have said to us, "Oh well, you know, we've tried this before, we've seen this before, and it didn't work, or it doesn't work." And I suppose we had a job in bringing them along and showing them, you know, why it does now work, you know. And I think one of the great things for us, in terms of getting patient adoption, was just being able to show how, you know, over the last 10 or 20 years, we've all moved from dealing with our banks in very different ways, and becoming accustomed to food delivery and food ordering, really predominantly using apps now these days. And there's really no reason from a customer point of view that you wouldn't want to do the same thing with your pharmacy. And we see some pharmacies now today actually at nearly 50% of their business going through their PharmacyConnect app. So that's been very encouraging.
And how reliant have you been on pharmacies that are using this app to actually bring about adoption from the patient side?
So it's very much up to the pharmacy to drive that adoption. So as I mentioned to you, you know, these apps are not something that we're out in the marketplace pushing on behalf of the pharmacy. That said, we do give each pharmacy a toolkit, and we have, I suppose, a proven plan in terms of what is required to get their patients to adopt the app. And really, to a large extent, they're pushing on an open door, and you would probably be able to guess a lot of the things that you would do to drive patient adoption. I suppose the first thing, first and foremost, is that the staff are behind it and the staff believe in it. So one of the things we do, one of the first things we do when pharmacies adopt one of our apps, is we make sure that we bring staff through the platform and make sure that they know everything that it can do, and the important things to do from day to day. And once that happens, and then once they start to talk about to patients about it, and they might put an update on social media and signage around the pharmacy, once you do all of those kind of things, then it really just snowballs from there.
And how many pharmacies and patients are using the app today?
So we have nearly 40 pharmacies around the Republic using the app today, and there are about 200 individual pharmacy users using it. And we're just recently announced that we've just surpassed 200,000 patient interactions with the app since we launched. So we're very grateful for that, for hitting that milestone.
And what is the revenue model that underpins the business?
So as you might imagine, it's completely free for the patient. So really, how our business is classified is a B2B or a business to business software as a service. So we charge the pharmacies a monthly fee to license the software. And then as part of that, we also provide support and whatever they need to grow usage.
Is there an ability going forward that you could integrate this as well with maybe the GP practices, so that if a patient needed a prescription or a repeat prescription, that they could put in the request through the app to their GP, the GP then could upload it, and then the pharmacist could then prescribe it?
Absolutely. Look, I mean, integration really is key, and to be able to keep driving on being able to integrate with existing pharmacy systems and GP systems, it's really the holy grail. And I think it makes a lot of sense in terms of being able to save time, both for pharmacies and doctors and patients, but also to be able to reduce potential errors. Then having that kind of integration in place is really something we'd be very supportive of, and something we're discussing with players in the industry at the moment. And
finally, Cormac, what are your long-term growth plans for the business?
Well, there are 1,800 pharmacies in the Republic of Ireland, so we'd love to keep deepening what we're doing here at home. But we are also looking at other markets that potentially we can bring the innovation to. So watch this space.
Well, if you've just tuned in, that was Cormac McKenna from PharmacyConnect, and we wish Cormac and the team every success for the future.
Southeast Radio's Business Matters with Karl Fitzpatrick.